So confidence definitely comes with experience, but you can also do something wrong a lot and feel like you're doing a really good job when actually you're doing it wrong. There have been various kind of methodologies for how we approach injectables. Codifications, for example, start with the midface, then you do this, then you move on to that. At the same time, often we find that sometimes there are a few high impact areas that get the most benefit from our patients. So for me, it's the interface between experience and then education, and that kind of builds together. There was definitely a penny drop moment for me when I was treating patients and I would assess them, but I would still not intuitively know exactly the right treatments that would work and I could suggest. Then there was a tipping point where I would look at someone and then I would just know. And obviously that you would change your treatment plan depending on what the patient is asking you and what their main concerns are. But for me, it was just a pure balance of education and experience. And at some point when you're consulting with a patient, you will feel the expertise and you will feel like you know you can deliver a good result. And the struggle is, I think, in your early practice, you don't have that. And so it is nerve-wracking. You do need some baseline principles. You do need a bit of a rule book. And if it doesn't feel right and it feels a bit wobbly at the start, that's just because that's what anything new feels like. And rest assured, with time and experience and education, it really does all fall into place.
The important concept there is doing the basics well. I think we live in a world now with aesthetics education. It's so easy to do so much, and people will do a foundation day, they'll do like a nose course, a tear trough course, because they think that's what patients want. I think, as you mentioned, you want to be doing 90% of your day-to-day treatments very well, and that is the basic toxin, basic filler. If you get asked to do a nose once a month, you're probably not going to be very good at it. So you're probably better off referring anyway. You don't want to be offering a whole spectrum of treatments that actually you're not that competent to deliver on the outer edges. In the world we live in now, there's too much choice and there's too many opportunities and there's too much social media telling practitioners they need to be able to do tear troughs. I've gone from, at the beginning, wanting to learn more, trying to do more courses, trying to offer more advanced treatments, and actually now in my practice, I've actually gone right back down to actually not wanting to do those more advanced treatments, because often they're associated with lower patient result, happiness, satisfaction rates, but also more complications as well. And you can have, and I think it's important for people that are listening to this, that you can have a really successful, thriving business by offering the basics well. You don't need to be offering those more complex treatments initially, if at all, if that doesn't suit what you're after in your life.